It's your body, it's your baby.
Dr. Sara Kayat is a GP with a special interest in sexual and reproductive health.
So that first trimester and most of the second trimester, you actually just need to be eating your absolute normal amount. There are lots of resources out there that are not reliable. I think we just need to really give ourselves a break.
Dr. Sara is the resident GP on ITV's This Morning. Her first book, How to Have a Baby, is an empowering, unbiased guide for women going through pregnancy, labour, birth, breastfeeding and postpartum recovery.
Knowing what's normal for you, not feeling embarrassed or shy about discussing it with your doctor.
What about exercising in pregnancy?
I think it's just a matter of knowing what your choices are, but it's so important to listen to your instinct.
How can women advocate for themselves during labour?
I think knowledge is power. If something doesn't feel normal, it means something.
If someone's listening is pregnant or just postpartum that is just not enjoying it, what would you say to them?
This too shall pass.
Hello everyone and welcome back to Vision of Health, the podcast where I talk to qualified experts about what being healthy really looks like in everyday life. I'm Dr. Frankie Jackson-Spence. I'm a medical doctor specialising in cancer research. My mission is to bridge the gap between science and real life, offering you practical advice to help you improve your lifestyle that is actually backed by the evidence. I'm Dr. Frankie and this is my Vision of Health. When covering women's health, we can't neglect talking about reproductive health. For so many women, much of their life is spent either trying to conceive, being pregnant, or in the postpartum period. Our next guest is here to educate women on how they can advocate for themselves during these periods. Dr. Sara Kayat is a GP with a special interest in sexual and reproductive health. She's here to equip you with all the knowledge so you can go into pregnancy, childbirth, and that postpartum period with confidence. Dr. Sara, welcome to Vision of Health.
Thank you for having me.
Thank you for squeezing me in. We were just saying about how busy our days are, but I'm really glad we can talk about this topic because I think we just kind of expect women to just get on with it. And actually so much of their life is occupied with trying to conceive or being pregnant or recovering and then being a parent, that actually we just need more conversations about women's health, don't we?
100%. You know, as you say, people are just expected to know this stuff. And I don't really know at what point we were taught it to know it. And a lot of it is learned. It isn't, necessarily a natural thing that we all just have in us.
Yeah, I was speaking actually to my sister-in-law this morning and she is just had her second baby. And she was saying to me how much easier she's found advocating for herself, having done it once. She's like navigated a bit more. And it made me realise when I was writing these questions, how much I actually don't know. And so I think it's a great episode where we can go through different stages and kind of equip everyone with what they need to know. So let's start off with pregnancy. Mm-hmm. If someone gets that positive pregnancy test that they've been waiting for, aside from celebrating, what is the first thing they should do?
Yeah, well, look, I think the celebratory bit is the big bit because actually loads of people have such different journeys and some people's journeys are so difficult to get to that point. So don't kind of brush over that celebratory bit, really embrace it. But in terms of kind of more logistical things to do, the first thing you need to do is get booked in for your first antenatal appointment. Now that's with a midwife and it usually occurs somewhere around the 8 to 10 week mark, but can be anywhere up until 12 weeks. And for most people, actually, you can just do that yourself. You can self-refer now, which I think is really easy. We still get some people coming into the GP practice asking us to do it for them. But actually, you can just, the minute you get your pregnancy test, you can go on your laptop and sort it out yourself. You just have to think about which hospital you want to go to and that's it, done. And then the second thing I did was get my TFL baby on board badge because people are savages on the tube.
Oh yeah, that's a great excuse to get a seat. And what if someone has not necessarily done the pregnancy test yet, or indeed they have and they're not sure what to expect? What are some of the symptoms of early pregnancy?
Now, the symptoms can really vary, but a lot of people will suffer with the nausea and kind of vomiting, the morning sickness side of things. You can also get the breast tenderness. It's similar to that which you get when you're on your period or just before your period. But I think the symptom that lots of people get but weren't expecting was the fatigue. There is like this really savage fatigue that comes along with that first trimester. And, I remember going to bed at 7:30 just to sleep it off. So I think people aren't always expecting it, but it's a big one.
Yeah, that must be really hard because everyone expects you to be really excited and happy. But actually, I think some of those symptoms can be really disabling for women. They, in bed the whole time because they're really tired.
And it's often at the time, that first trimester when you haven't told people about it either. And so you're trying to navigate, this fatigue, this nausea, and still get on with your everyday life, going to work without anyone knowing. It can be quite challenging.
That's actually really hard. It's a good point how to conceal it. Like if I didn't go to the gym or something, everyone would be like, what was wrong with you?
Exactly.
I probably would get outed for that sort of reason, actually. I didn't think of it like that. You mentioned there about the nausea and vomiting. That's the one that we all have heard of, the morning sickness. Why do we get morning sickness?
It's hormonal changes primarily, but also we get a laxity of some of the muscles, so the esophagus and the sphincters in our stomach, which allows the acid to come back up. We also get some of the pressure building up because of the changes within our abdomen. That means that we end up getting more acid coming up as well. And for some people, it just gets so significant that it turns into something called hyperemesis, gravidarum. And that one is, where you basically can't keep anything down. And you're getting significantly dehydrated. And in those cases, you have to go to hospital for it.
So how do you know at what point it's normal morning sickness versus something more serious like hyperemesis?
So what I would say is, normal nausea and morning sickness will affect you. Yes, of course, you'll feel unwell and unhappy, but you should still be able to get on with your everyday life. Mm-hmm. And you should still be able to keep food down. You should still be able to then pass urine and know that you're still getting enough fluids in you. But with hyperemesis, those are all big red flags.
Okay. And I once read something, it's probably a myth, but can you predict the sex of the baby based on how much morning sickness you get?
Not reliably, no. So it is a myth, but there were some studies that showed that you had a greater HCG, which is a chemical in pregnancy, with female pregnancies. And we know that nausea is related to that hormone. And so I guess there is that possibility that if you had a girl that you might feel more nauseous, but there's so many variables, and we know that nausea and vomiting associated with pregnancy vary so much between people and between individuals' own pregnancies as well. So I don't think it's reliable enough to use it as a way to find out.
Social media thing, what everything's like on socials. Yeah. So on the topic of feeling sick and not being able to keep anything down, I think that must really concern women because there's so much talk about pregnancy nutrition and eating for the baby and like what supplements and things we should take. And I suppose that if you've got really bad nausea, that's going to affect what you can eat.
100%. I remember with my first pregnancy, I had this idea that I was going to be like this green goddess feeding it like green smoothies and broccoli every day, and it's going to just be the super healthiest fetus that's ever existed. And then I got morning sickness and all I ate for 12 weeks was cheese toasties. Yeah. And I was just like disgusted with myself, and I was like, oh God, this poor baby is going to end up, I don't know what I thought, turning into a piece of cheese. So I think, yes, you have this ideal of what you want to be able to offer your fetus, and then you've got the reality. But in the end of the day, it is 12 weeks, and then most people's will start to improve. And certainly by 16 weeks, most people's has gone. And then you've got the whole of the rest of the pregnancy to try and eat as well as you can and as healthily as you can. But, give yourself some grace. And then that's what supplements are for, to bridge that nutritional gap where you don't feel like you're able to take in the right dietary supplements.
So what supplements should someone be taking in pregnancy, and at what point should they start?
Well, there are two main supplements that are recommended on NHS guidelines. So we've got folic acid, and that should actually be started 3 months before you fall pregnant. So it's one of those ones that if you are thinking about trying to conceive, start it. There's no harm in starting it early, and then hopefully you've then got a nice amount of folic acid in your body to make sure that you don't have a baby with a neural tube defect, so essentially a defect in the way that the spine is formed. The other thing that is recommended is vitamin D, so 10 micrograms of vitamin D. for all pregnant women, and then also when you're breastfeeding as well. So continue that throughout.
And what about for women who may have an unplanned pregnancy, so haven't been taking these supplements pre-conception? Is that a bad thing, or can they just start whenever they realise?
Yeah, I would say, look, in an ideal world, you start it before so that you've got enough in your system, and great, because most of the neural tube defects in terms of folic acid occur in those earlier weeks when the fetus is developing. But I would say just take it as soon as you find out, and there will still be benefits then.
I think everyone just has to do the best they can with the information they've got at the time.
Exactly.
Isn't it? I definitely see people beating themselves up a little bit that they, again, similar to the nutrition thing, wanted to plan it better than it's gone.
Yeah.
But you can only work with what you've got at the moment. I think people need to let go of that guilt.
Exactly. Look, you've got decades of mum guilt to feel, and it's one of those things that you just do the best you can. Just try and get through it. Some people's journeys are just so much more difficult than others, and you just can't compare yourself to someone else's journey either. So, give yourself a break.
Everyone knows that you shouldn't drink alcohol during pregnancy. It's like the one thing everyone knows, isn't it? Is the risk the same throughout all 3 trimesters? And is it safe to just have the odd glass here and there?
So when it comes to alcohol, unfortunately, there is no safe amount that you can drink.
And that's the same if you're pregnant or not.
Exactly. Pregnant or not, exactly. But it's just that there are limited studies in terms of pregnancy, because obviously that would be quite unethical to give one group lots of alcohol and one group no alcohol. And so all we have is these studies observing women who have had alcohol throughout their pregnancy and seen what the potential effects could be on the child. And so that being said, the best amount of alcohol to drink is no alcohol during pregnancy. Now, your question about whether there are times in the pregnancy that are safer than others, we know that the first trimester is when your fetus is at its most vulnerable during its development. So I suppose we'd say if you were going to drink, then maybe not that first trimester. But again, ideally, nothing. I think the odd glass now and then is probably fine. It's probably nothing I should be saying to people to drink. But I also don't think I can preach. I conceived my first on a wild 40th birthday party in Croatia, and my second, again, they've always been alcohol induced. So I shouldn't, I definitely don't want to preach to people. But the line on it is that no alcohol is safe.
Yeah, I get that. I think it's good to just hear it. And I think for lots of women that have had a difficult journey getting to pregnancy, they're kind of like can be quite hyper aware of not doing anything wrong. And I've had a few friends ask me about like whether it's safe to drink coffee and whether caffeine is a risk. What about coffee? Is that safe to drink?
It is safe to drink, but in moderation. So the guidelines are 200 milligrams of caffeine a day. So that's around 1 filter coffee, or maybe like 2 cups of tea. And that's because higher amounts can result in a lower birth weight baby. So, most people, 1 or 2 cups is probably fine. But yeah, if we can stick to that 200 milligrams, then you're limiting your risks.
Great to know. It's good to know. If I ever get pregnant, I won't have to give up my morning coffee.
Well, you know what? I gave up mine and just switched to decaf at the time because, I just thought, well, that way I can still drink throughout the day. And actually, I've never gone back. So it's been 5 years and I've not had any caffeine and it feels great. Okay. So you can take it as like as part of the journey and then kind of run with it. It feels good not to have to rely on something, honestly.
Yeah, I do feel that. And actually, I read some interesting study recently about how the benefits of the antioxidants in coffee is the same for decaf.
Yeah, it's in the coffee itself, not in the caffeine.
Yeah. So fair enough. We'll put that one off for a while. What about exercising in pregnancy? Is it safe to exercise, and is there anything that people should avoid?
I always feel quite sad when I see stories about women not exercising because they're pregnant. And I think actually the opposite is so true. I'm not suggesting that people should decide to run a marathon if they're not runners or, do anything in extremities. But we do know that exercise can help with labor and the endurance of labor. We know that it can help with the muscular aches and pains that you develop. And also it helps with postnatal recovery. So definitely you can exercise. There are just some adaptations that you need to do, and most PTs and classes that you go to will all be able to help you with those adaptations. And they're simple things. They're just rather than lying flat on your back, you'll be at an angle, stuff like that. So you can still really engage in exercise. And I honestly put down me exercising throughout all my pregnancy to like my super quick labors. I really think it was the exercise that did it. So I encourage it for anyone that is planning to get pregnant or is pregnant anyway. Do your exercise. Don't feel worried about it. Just don't do anything crazy. Don't overheat. Rest when you need to rest. Keep hydrated and just stick to those adaptations.
Yeah, I think that's great advice. I think being able to keep as much of your routine and life than things that make you happy as much as possible, rather than it being this thing where you have to cut out all the things you enjoy.
Exactly.
It's so important. So just completely different question. Is cramping in early pregnancy normal? Someone asked me to ask you this.
Oh, okay. So it can be. Our womb is adapting quite significantly in early pregnancy. You've got your implantation of the baby into the womb. You've got the stretching of the womb and the ligaments themselves. So yes, cramping can be normal, but if it becomes persistent, becomes increasingly bad, or it's associated with anything else like bleeding, for example, those are signs that you do need to see someone about it.
So any bleeding, you'd need to see someone.
I would say any persistent bleeding, you should see someone. Sometimes as I say, that implantation bleed, you might get a little bit of spotting and then that should stop. But if it persists, then it does need to be seen.
Okay. And there's some complications that can come about through pregnancy. And if someone's not been through it before, they may not be aware of them. Gestational diabetes is one. Lots of misconceptions around it. What is gestational diabetes?
So it's when you are unable to control your blood sugars as well during pregnancy. And it can result in some issues with the baby. So one of the most kind of prominent issues is that the baby can become larger and that can then make labour a bit more difficult. So we test your blood sugars quite early on if you have any of the risk factors for gestational diabetes. And if you do come up as positive as having gestational diabetes, then both you and your pregnancy are monitored a bit more closely, and you're given some information about how to control blood sugar levels, and you may be given medication as well.
And is it to do with like how much sugar you eat? Because I think there's a lot of guilt surrounding this.
Yeah.
But for some people, they have a predisposition to it. But
yeah, that's the thing. There are some people that are predisposed. So, for example, some ethnicities and also your weight can factor into it. And I think you're right. There are so many different kind of things to feel guilty about and worry about in terms of your own lifestyle. And I it's not going to be as simple as, oh, I ate too much sugar this day and therefore I've got gestational diabetes. But, a healthy lifestyle does help limit some of those risk factors. But if you do have gestational diabetes, it can be well controlled. We can make sure that your baby is safe with it. And it doesn't necessarily mean that you're then going to go on to get diabetes itself. It can put you at a higher risk, but it doesn't necessarily mean that. And so if we catch it early, we monitor it well, then hopefully it means nothing, more adverse for your pregnancy and yourself.
It's great to hear so many of the things you're saying are kind of busting the myths and misconceptions that women are to blame for things that come up in pregnancy in this way. I see lots of quite emotive posts on social media about this sort of thing where people maybe haven't been told the right information. So it's great to hear that, first of all, that you can kind of limit side effects, and also that sometimes it's out of your control. On the topic of things that are in control, how much weight is normal to gain during pregnancy? And is there any negatives from gaining too much weight?
So a normal amount of weight to gain during pregnancy actually depends on your BMI before you fall pregnant. So if you're in that kind of healthy bracket of BMI, then somewhere between 10 and 12 kilograms is probably a normal amount to gain. You'd expect to gain less if you have a higher BMI and more if you have a lower BMI. Now, we do know that if you put on too much weight during pregnancy, that can have detrimental effects on both your kind of labor and your pregnancy journey, as well as, potential risks for your baby. So we try to monitor weight, but, I think during pregnancy is not the time to start a crash diet. So it's one of those things that actually, if you are worried about your weight, it's worth looking into that before you fall pregnant, just so that we can try and kind of work on that and work on lifestyle things before pregnancy. Because when you're pregnant itself, that's the time you just want to kind of try and keep things as status quo as possible rather than change too much. There are still, healthy diets you can go on, but we just don't want anyone doing anything too extreme. Yeah.
And I think on the flip side is, you do hear a lot of people saying, oh, but like, I need to feed the baby, but you don't have to eat that much more than normal.
No, you always see people saying, oh, I'm eating for two now. And it's a bit of a joke. It's a bit of a tongue-in-cheek joke, but actually, you do sometimes feel like you are eating for two, but it's just not. It's not necessary, especially in that first trimester. So that first trimester and most of the second trimester, you actually just need to be eating your absolute normal amount. And thereafter, you probably only need, 300 calories more. So, that's an avocado more rather than doubling everything else.
Yeah.
So I think some of those kind of those myths around food still persist and are probably quite detrimental for pregnant women. So I think, eat if you're hungry, snack on healthier things, and monitor the weight, but not obsessively.
Yeah, that's great advice. Should people, as they're approaching birth, make a birth plan?
I actually really advocate for birth plans because so usually what you'll get is this book, your maternity notes from the midwife, and in it there'll be one sheet, like 2 sheets of papers with questions and boxes, and that's your birth plan. You fill that out, and I think it's helpful because it asks the questions you probably didn't realize you needed to answer, and it helps you know what you do and don't want from your pregnancy. But the only part about a birth plan I find a bit tricky is that most people's births don't go exactly to their plan.
See, that's what I think I'd worry about. I like sticking to the plan.
Yes, and I think if you're that kind of personality where, or you feel the need to control situations a bit more, and so you've written this plan, you're like, well, I know what I want and this is my plan, and then it doesn't go to plan and you're not the kind of person that can go with the flow. I think it's quite hard to then break away from that plan. But I quite like the idea of calling it a birth guide.
Yeah.
Because then it's less rigid. So you can say, this is my birth guide. It's a guide of what I'd like to happen. But I also think it's worth in that guide saying, well, if this can't go to plan, this is what else I would like.
Yeah.
So I think just having an idea of what you hope for, but maybe being flexible in the knowledge that it may not necessarily happen in that way.
Yeah. And I think it's good for getting people to think about what's going to happen next.
Yeah.
Because I'm definitely someone that would be petrified about the birth.
Aww.
So I probably wouldn't think about it unless I was told to.
Being made to, yes.
But preparation is usually key.
And yes, and I think it's also really good because you can involve your partner with it as well. So with the birth plan, so that they actually know what the plan is. And it may be that you get to a point where you aren't able to make those decisions on that day. You may be too exhausted, or you may, feel too unwell, or, whatever the reason. And you'll have to rely on your partner to give those answers to the midwife or the doctor. And if they haven't been involved in that birth plan, it can be difficult for them to help you out as well. Yeah. So I think it's one of those things that just gets everyone talking, gets midwife talking to you about what you want, gets you talking to partners and other people around you about what you want. And it just opens up that conversation.
Yeah, and it helps you advocate for what you want rather than just being told this is what we do and this is how you're going to have it.
Exactly.
Do you have any advice for anyone listening, like me, who would be frightened about birth?
I think, look, I understand why people would be frightened, because you go to any movie about pregnancies and birth, anything where a woman is giving birth and you see this person screaming, yelling, it's just this big old mess, and you're like, I can't visualize myself in that spot.
Yes.
But it doesn't have to be like that. And I think it's also worth remembering that a lot of people that talk about their pregnancies are often the people that have had traumatic events, maybe triggering events that they actually are, they're offloading as well. They're talking to your friends, you talk to your friends about the traumas that have happened to you. It's not often that you hear the good stories, but they do exist, I promise. What I found super helpful for me was hypnobirthing. And I think for anyone that feels a little bit anxious about what labour might look like, it's really worth thinking about hypnobirthing, because it kind of takes you on this journey of staying calm, staying advocated, staying empowered, and it reinforces the positive affirmations and the positivity around giving birth. I had like all these affirmations stuck all around my house. Like I'd go to the loo, I'd be sitting on the toilet doing a poo, and then there'd be this like affirmation stuck on my wall saying, "You have the power within you," and stuff like that. And it sounds so cheesy, but honestly, by the time the labor came, I was just like, I can do this. I can do this, because I just had it everywhere telling me that I can do this. So it's worth thinking about.
I love that. I suppose as well, when we were talking about exercise during pregnancy, for me, exercise always kind of proves my strength and makes me think, you know what, I can get through the hard thing, I can get through that pain. Yeah. It really builds resilience. And I guess that's one thing that I suppose if you've exercised through pregnancy, that you have learned that.
Yes.
Your body's capable of more than you think it is.
Yeah, exactly. And sometimes you just need to kind of breathe through the pain. When like you're doing an extra rep and you're like, I can't do this. Then you say, just breathe through this, just get through this one more rep. And it's kind of the same in a weird way. You're like, breathe through the contraction. I can do this. I know I can do this. And it will end. This isn't me forever. And then just knowing that you can feel the power to get to that next step is kind of all you need to do.
Yeah, your mind gives up much sooner than your body does.
Yeah.
What are some of the most overlooked aspects of preparing for birth?
We get a lot of information about the leading up to birth, and the preparation for labor and things like that. But I don't actually think we get a huge amount of information about what to do once the baby's there. Like you're just like, okay, I got a baby now. What happens? And I think we're obvious, and it's natural. It's our natural instinct to get all the information about the things that are about to happen immediately. You want to learn all about what's going to happen in labor, and that's the big thing that kind of you worry about. But then I think because of that, you neglect the next stages, or certainly I did. And so I think that's an area that really does need to be focused on a bit more. And it's actually why I wrote it in that part of the book, those chapters in my book, because I wanted there to be that first year and information about what to do with your baby in that first year. Because I know with my first pregnancy, I was more troubleshooting at that point. I was like, oh, this problem's happened. Let me Google it quickly. Whereas it would have been nice to have been prepared for it. So I was a bit calmer about what I needed to do with my baby.
Yeah, and like what's normal and what's not.
Yeah.
So just going back to the birth, and then I definitely want to touch on the postpartum recovery in that first year. How much choice do women have? Do they have a choice over their birth options?
There are lots of different birth options available, actually. And I think that being able to control those decisions I think can be quite empowering. So I think it's just a matter of knowing what your choices are. So the first decisions you need to make are where you're going to have your baby. So, you think about which maternity hospital you want it based at, or do you want a home birth? And then you divide that into, do I want it to be in a birthing centre or in a labour centre? And then you can think, well, actually, do I want to have a vaginal delivery or a C-section? So, and then within that, you also have pain relief to think about, what the types of pain relief you'd like. So there are lots of things you can make decisions about. And I think it's worth looking into those things beforehand. But also be flexible in the knowledge that actually things might change. So you might say, no, I don't want an epidural. I'm okay without having one. And then you get to the point and you think, oh my God, I need an epidural. And And that's okay to then have, providing you haven't chosen a birthing suite, for example, because then it can be difficult to get one. You need to be at the labour centre. So you need to kind of factor those things into your decisions.
I don't think many women know that they have that much choice.
Yeah.
I don't think many women know that they can choose a C-section, for example.
Well, this is it. In the UK, we are allowed to choose for a C-section. And actually, if your obstetrician says, no, they don't agree with that, you are entitled to ask for a second opinion from somebody else and to try and get a C-section from someone else. I think it's a really important choice to make. It's your body, it's your baby. And I think traditionally, there was some adversity around choosing a C-section, thinking it's the easy way out. Yeah. It is by no means the easy way out because, you know, the postpartum recovery can be really difficult. So I think that's changed a lot over the last decade. And I think being able to make that decision has really changed the way that women view pregnancy and birth. And I think it's a really positive change.
Yeah. I think it's really difficult because on the one hand, there is still some of that judgment around, like you said, it's the easy option, which when medically you know what actually goes into a C-section, it's one of the most brutal things I've ever watched. Like, it's not to put anyone off that has to have one, but it's not just like a quick thing. It is still a big deal to put your body through. And like you said, the postpartum recovery is still a big stress on your body.
It is.
I wouldn't say it was the easier option, not that I've had either. But also on the flip side, that narrative also can make some women who have to have one almost like disappointed that they can't go through it vaginally or naturally. And I think that's also really hard for some women to kind of accept that they couldn't do it. And I think that we need to just open up that birth of birth.
Exactly. I think, it kind of marries into breastfeeding a little bit, is that whole kind of not being able to do what's supposedly natural. But there is very little that's natural about what happens to us during this entire kind of postpartum period. It's all very, very different to our everyday normal lives, especially as modern women now. And so I think we just need to really give ourselves a break and not feed into this narrative of what is natural and what is the easy way out or the unnatural way. I think, as you say, we just need to get through this as a team, as a team of women, as your micro team of your family. Just get through that part and do what feels right for you and your family.
That's so important. Thank you. How can women advocate for themselves during labour?
I think knowledge is power. So really knowing what all the options are beforehand helps you to make that more informed decision, because in the middle of labour, when someone says to you, okay, we're going to have to do, this induction, or, we're going to have to use forceps or whatever, having to then understand what forceps means and what it could, what the potential risks are very difficult when you've been in labour for 12 hours. Your brain is just not in that kind of functional way. So I think trying to get all of that information before, so that when those words are mentioned, you can make those connections quickly and then say, oh, actually, no, I didn't want that, and things like that. I think also making sure that you know what they're saying in relation to you specifically. So that sounds a bit weird, but for example, induction of labour, at 41 weeks, it's offered to everyone because the risks of stillbirth, for example, can go up after that point. But we know that the risks are higher in certain groups. And I think it's really important to say, okay, you're suggesting this, but is this specific to me and my case, or are you just suggesting it as a general thing? So I think always just asking, why are you suggesting it? What does it mean for me? What are the other options? And just making sure that you've got all of the information rather than just taking what they say as gospel. Of course, the doctors and the midwives all want what's best for you and your baby, but it's important to know that they're tailoring their advice to you specifically.
Yeah. And your book, How to Have a Baby, is a great toolkit for people to read in preparation for this. What other sources of information you'd recommend people go to get that knowledge to make the informed choice?
Well, this is partly why I wrote it, because actually when I was trying to find information, I thought it was quite limited. So you have really important resources like the NHS websites, but they don't go into much detail about the whys. They'll say this is this is X, this is what it means, but they don't go into the science behind the numbers of people needed to treat in order to get this. They don't go into the specifics, and I think it's really hard to make informed decisions if you don't actually understand why those decisions are being made. So there is information out there. There are plenty of papers. There is the Royal College of Obstetricians and Gynecologists website. And you can go to all of those resources reliably. But there are lots of resources out there that are not reliable and that are at best don't offer anything, and at worst can be really harmful. So choose your resources wisely, stick to the reliable ones. And I've tried to condense all of the information that is reliable out there into this one book. So hopefully those that do read it can come away with as much knowledge as they were hoping for, with a little slant of funny anecdotes and stuff in there.
Love it. I think it's important as well that your advice is actually unbiased, because you touched on this before. When people share their own experiences, often there is that element of emotion and personal experience weaved into that. So for example, if someone's had a really negative experience of a C-section, their views will naturally have a bias to them.
Yeah.
Whereas as doctors, and especially when you work as a GP, you're presenting the pros and cons of all options. And that's important, to not just listen to someone's experience.
Yeah, look, experience is important to, and it builds bonds and it builds understanding. But and actually, I think even doctors have a bias. So I think specifically gynecologists and obstetricians will have their own bias in that area, absolutely, because they want to minimize risks.
Yeah.
And that's completely acceptable. I think as a GP, it's a little bit different, because you're one step removed from the literally being the person that cuts the person open in the C-section. So you've got all that information as the doctor, but you've also got the understanding of how it works within that family unit and things like that. So I think as a GP, you're just one step removed that's able to give that unbiased opinion.
Yeah, that's important. Let's move on to the postpartum period and recovery. We've covered pregnancy and childbirth, I think, pretty comprehensively, but everyone should read the book if they want to learn more. Postpartum care can be really variable. And I think from speaking to friends that have gone through it, they feel that in their second pregnancy, they're much better equipped to advocate for themselves. Yeah. And I guess that comes into the knowledge being power narrative that we talked about. How can women advocate for themselves in the postpartum period to get the care they need?
I think in the postpartum period, you just, especially in your first pregnancy, you just don't know what's normal. But it's so important to listen to your instinct. And if something doesn't feel normal, doesn't feel right, it means something. It really is your body and your mind telling you that this is not what is innately meant to happen. And I know whenever a patient comes in with their child, and even if their child looks absolutely normal, the minute they say, I just know this isn't okay, you put your medical hat to one side and you just say, okay, we're gonna refer you, we're gonna test you, we're gonna do it, because those words actually mean something. And I think in that postpartum period, when your body just is all feeling so different, your baby is just this brand new thing that you don't really know what to do with, and you've just got little alarm bells going off in your head, listen to those and run with them and speak to anyone you can speak to, and get them to listen.
That's so important. And what about things for the mother's own recovery? Because things like pelvic floor physio is not necessarily offered to everyone routinely.
No, it isn't. And it's something that I've been working really hard on to try and get a narrative going in the 6-week check. So usually what happens at a 6-week check is the GP will ask you a whole bunch of questions about, your recovery, your pregnancy, your birth, all those kind of things, and just make sure that you're all good to be released back into the wild again. But one of the questions on there will be like, have you had any problems with incontinence? And most women, because it's such a quick question and because you're feeling a little bit awkward and a bit embarrassed, most women often will just be like, everything's fine. But if you just take that time, as the doctors say, have you noticed any leaking? Or, has there been any change? People will often say, yes, there's been a change. And then it kind of opens up that dialogue a bit more. And I think it's important for both doctors to try and open up this conversation a bit more and offer more support in terms of postnatal health. But it's also going to be on the patient to try and be as honest as possible as well in those fields. So I think, knowing what's normal for you and not feeling embarrassed or shy about discussing it with your doctor is probably the best advice I can give. There is help out there for pretty much anything that's gone wrong after childbirth. It's just about accessing it.
Yeah, and knowing that this isn't just how it's supposed to be.
Yeah.
I think on that note, pregnancy and the postpartum period can be really emotionally intense. Mm-hmm. Sleep deprived, you've gone through a massive stress of labour, you've now got a newborn, hormones everywhere. At what point is kind of emotional lability normal versus it becoming like postpartum depression?
So baby blues is essentially normal. Everyone, as you say, kind of feels tired, feels emotional, feels drained in those weeks after pregnancy. If that extends past 2 weeks and or is particularly severe in its nature, you're feeling low in mood, depressed, you're not enjoying things that you used to enjoy, feelings of helplessness, hopelessness, worthlessness, all of those kind of things. If those are happening and it's past that first 2 weeks when your hormone levels should have hopefully stabled out a little bit more, then we define it as postnatal depression. And it is definitely something that we need to try and get on top of as early as possible and try and offer as much help as early as possible for.
And I think that's the same with any mental health condition. Even when it comes to depression outside of pregnancy or postpartum, many people have the misconception that they need to be really low to ask for help. And actually, it is better to get help early with any of these things.
Exactly. I think when you're already in this like horrible pit and you're at that bottom of that pit, it's so much harder to lift yourself up and take yourself out of that. But if it's that we're getting you at the beginning, where you still kind of feel like you might have the energy to get up and move and speak to someone and see people and get in the shower and, do all those things, it can be a little bit easier for us to support you.
And is postpartum depression quite common?
Interestingly, 1 in 10 pregnancies have postpartum depression. So really common.
Yeah. And that's reported. There's probably women that are.
Yeah, there's going to be so many that are suffering in silence. Exactly. So I think it's really, it's really common. We don't talk about it enough. And I think even, peer-to-peer, like, within our mother friendship groups and things like that, we probably don't support each other enough with it because maybe we're too embarrassed or too ashamed to say we were one of those people that had it. But actually, it's so common.
And I think the society in which we are bringing up children in now is more difficult. There's that saying, it takes a village.
Yeah.
And many people don't have that. We move away from our families. A lot of our time is spent working. Suddenly you're not in that environment. You don't have your colleague support and things like that. I think we just expect ourselves to just get through these things and then feel shame when it's hard.
Yeah, that village is somewhat non-existent. And I think it's really important to find your version of that village. I know in this society, it's very difficult to have, the archetypal village, but find that version of the village by finding some little NCT groups of friends, your group of friends that have also got babies at the same time. Even that village in terms of your health visitor, your GP, the healthcare professionals as well, your family that is around. Just try and lean on these people as much as you can in those early stages.
Yeah. want to talk a bit about breastfeeding. We touched on this earlier. Let's start with, what are the benefits of breastfeeding?
There are undoubtedly a number of benefits. I think for the baby, it's nutritionally, the perfect kind of combination of all the nutrients for the baby. We know that it also helps in terms of immune health. So babies that are breastfed have lower risk of certain infections, ear infections, respiratory infections, etc. There are also benefits to the mum as well. There are kind of lower risks of things like breast cancers. There's improved kind of a weight stability after pregnancy. There are lots of benefits to breastfeeding, and I think we have stopped talking about the benefits lest we I guess makes women who have been unable to or choose not to breastfeed, feel more sadness or more shame about not being able to. But I do still think it is important to fly the flag for how beneficial it is for both mum and baby anyway.
I think that's important too. But for those women who are struggling with breastfeeding, either they're not able to or they keep getting things like mastitis, which I hear can be horrific. What are their options?
Look, if you have any difficulty in breastfeeding, the first person you speak to would be the health visitor, or the midwife initially, then it goes to the health visitor. If you're not getting anywhere with those, you speak to your GP as well. And if you're still not getting anywhere, then you can get a lactation consultant. So there is support out there, but I think it can be really difficult to access it. And it really takes someone to keep pushing. I had a bit of trouble with my second pregnancy. She had a tongue tie, but it wasn't an obvious one, and I knew something wasn't right, but I'm not. I don't assess for tongue ties. So I spoke to the health visitor. She was like, "No, it seems okay." I spoke to the GP. They were like, "Oh no, everything seems fine." And I was just like, this isn't okay. So then I went to speak to another health visitor. She said she'd refer me to someone else, and it never happened. Eventually, I went privately to get it looked at, and it was a tongue tie. But as a GP, so I have the knowledge, I have the confidence, and it still took me about 5 blows back to be told no, to then really push for it and advocate for it. And I think there are lots of women out there that have far less confidence in this field and would just accept that first no, I think it's fine. And so I guess it's about really pushing when you're struggling, and that can be really hard when you're already tired and you're already knackered and you've got a newborn, you don't know what you're doing. But even if it's about trying to get someone else to do that for you, so a partner, a family, a friend, whoever it is that's around you, to try and do that pushing on your behalf when you just feel too exhausted to, especially if it's a breastfeeding thing, because you're already exhausted trying to get them to breastfeed properly.
I think as well, so many people hear the news of how much stress the NHS is under, and lots of people will probably comment on this video and say, but it's so hard to get a GP appointment. And I think what's hard about that is, for an individual though, you've got to keep trying. You've got to advocate for yourself. Like, the public health situation is not an individual's responsibility.
That's a wider issue. You're right. And it's so sad that it affects the individuals themselves, but it shouldn't stop you from fighting for yourself. And just knowing what what's going on around you shouldn't stop you from fighting for yourself. But I totally and utterly recognize how difficult that is, even as a GP and as the layperson that had to do it for themselves.
Do women need to be on contraception once they've given birth?
So this depends on whether, you can fall pregnant after 3 weeks of giving birth. So so 21 days later, you are potentially free to fall pregnant again. Now, the advice is that you try not to fall pregnant for at least 12 months from your last pregnancy, because your body needs time to heal and you need the mental space and capacity to care for another baby too. So if you want to avoid getting pregnant and you're sexually active, then yes, contraception is a good idea from that point onwards. However, there is the option of lactational amenorrhea. So that essentially means if you are within the first 6 months, if you are exclusively breastfeeding, day, night, then you actually, the prolactin levels, a hormone in your body that helps create the milk, suppresses ovulation. So as long as you tick all the boxes for lactation amenorrhea, you can technically not use contraception for those first 6 months. But if any of those boxes are not ticked, then you do risk falling pregnant. And so I would suggest going down the route of contraception.
The female body is just incredible.
I know. Well, this is it. Isn't it amazing that your body was like, okay, well, I know for the first 6 months you shouldn't get pregnant again. So I am going to stop you from being able to get pregnant by, creating this hormone. Isn't it brilliant?
Incredible. And is there any particular type of contraception that's better for someone who's just given birth? Like, could you go and get a coil, or are you better take the pill, or...
So it does depend, again, on whether you've had a C-section or a vaginal birth. But in general, we try, and whether you're breastfeeding or not, if you are, then for most people, the safest thing to take would be, progesterone only. So be that the coil or be that progesterone only tablet, because you're at higher risks of blood clots and things like that post-pregnancy. And that can then be switched to the combined pill later on. But that is generally the safest one for most. If you want a coil, there is a higher risk of it being expelled immediately in the first 6 weeks after pregnancy, because your cervix is already dilated. But there are ways around it. So if that's your preference, there can be ways to have it either put in immediately after, or we can bridge the gap until you have it at a later date.
But that's worth knowing, because you might get some women that just start taking their combined pill straight after birth because they've got some in the cupboard. Yeah,
I think so you're meant to have a discussion about contraception at your 6-week check. Okay. But there are going to be some women that have start becoming sexually active before that time, and that conversation needs to happen before that 6-week check if you are going to be sexually active, because, as I say, 3 weeks later you don't want another baby.
Do you have any advice for someone listening who's navigating that first few weeks of the unknown and parenthood, that may have found this episode in a kind of moment of despair?
It is such a cheesy saying, and it's plastered all over every kind of parenting anything really. But this too shall pass is the one phrase that just kept me going. Every time anything felt too overwhelming, I knew that this was just a phase. It was just a phase, and it will change and it will get better. So this mantra of this too shall pass, honestly, is the one thing that just kept me going. And I would love you just to repeat that to yourself if you're in the depth of nappies, sleep deprivation, and regurgitation.
I love that. Many of us unfortunately know someone experiencing guilt because they know someone that's having difficulty getting pregnant, or they know someone that's had a miscarriage, because it's much more common than we talk about. And therefore, if they want to complain about their pregnancy or they're having a hard time, they feel guilty about it. If someone's listening is pregnant or just postpartum that is just not enjoying it as much as they thought they would, or as much as they feel expected to, what would you say to them?
That it's normal. We have this idea that, we're just going to, you're going to go through pregnancy, you're going to feel like glowing, because that's the word everyone uses. It's not glowing. You're perspiring because you're in pain and you're large and you couldn't get up the stairs. But everyone has this idea that they're going to be glowing, and then they're going to have the baby and it's just going to latch on beautifully and it's just going to be so easy, and you're going to look like this goddess of a woman holding their incredible baby that apparently doesn't ever cry and just sleeps all the time. It's not. That is just not normal. You're going to smell funky because you just haven't had a shower in a while. Your hair's going to be disgusting. Your friends are going to be like, she okay? And your baby is going to just be posseting all over your clothes. And it's normal to kind of be disgusted by it all, and that's okay. And lots of people don't just have this sudden falling in love with their newborn baby. That it's always depicted in movies and everywhere that you look at this gorgeous baby and suddenly you're in love. Well, actually, they're going to look like a roast chicken. They're gonna they're all wrinkly, their hair is falling out, their skin's peeling, and it's okay to take time to develop that love. That's okay.
Yeah.
And so don't worry about it. If you're that person that's just not sure why you don't feel all these things that you're supposed to feel, it's normal. It's okay.
Oh, I love that. That's so important. I'm going to ask you my final question, which we ask everyone on this podcast. What is your vision of health? What does health look like to you?
Oh, I think health probably looks looks very stable to me. So I people always talk about kind of these big feats of either exercise or nutrition or whatever, and these big things. And for me, it's just all about those tiny little things that work together to build yourself up. So the 5 pillars of health for me are, diet, exercise, sleep, social connections, and stress management. And for me, it's just a matter of trying to keep all of these fairly steady, so that if one falters, I've still got another 4 just to keep propping me up. And so for me, it's just about moderating those 5.
It's so much less glamorous than social media tells us.
Right.
It really is.
I know. I'm like, that's it. Done.
No, I completely agree with you. Dr. Sara Kayat, thank you so much.
Thank you. Thanks for having me.
Thank you so much for listening to Vision of Health. I hope you've taken away some practical and realistic health advice that you can implement to improve your lifestyle and get clear on your vision of health. If you've enjoyed this episode, then please do let me know by liking the episode and leaving me a review. If you want to hear more from me, then make sure you're subscribed to the channel. And if you have any friends that could benefit from improving their lifestyle, then make sure you share the episode with them. I'll see you next time.